The Facilitator MD, back at you again. The pandemic's over, right? No more 6 feet apart, no more mask mandates. We're not looking at the news every night to count the number of people that died, both here in the United States and around the world. We've pretty much gone back to normal, right? Let's talk about how Americans in particular have developed challenges in the way we interact with each other, challenges in our family dynamics, challenges in the behavioral health of adolescents, and how many of these challenges that have existed for thousands of years were exacerbated by the pandemic back in 2019.
Hi, I am Dr. Lisa Tropez Arsenault. I'm a pediatric psychologist, and I've been practicing for over 20 years, closer to 30 years, doing the work that I do, working primarily with children 0 to 5, and also working with at-risk adolescents with teenage pregnancies and maternal fetal health throughout the United States. I also do international work with burn care for kids in Central and South America, and working with them doing forensic evaluations to determine intentional versus non-intentional burn injuries.
Since COVID, there's been a worldwide focus on behavioral health. We're now beginning to understand the importance of well-being, mental well-being. But since the lockdowns, what are some of the behavioral health challenges that we are seeing within the population, and specifically in your specialty, in the pediatric or the young adult population?
So with the young adult population, let's start with 0 to 5, because I think it's different ages that were impacted. But anxiety and depression, we saw a huge increase in younger kids, particularly across the gambit after COVID, and at high rates that we did not see prior to COVID. Being worried about washing their hands, worried about dying, worried about mommy and daddy dying, worried about friends dying, family members dying. Not being able to have that normal interaction with friends and going to birthday parties. All the way up through when you look at college students who, as they were going away to college, and now they have to return home and do their college classes from a computer and online platform. So a tremendous amount of increases in anxiety with now they have to return to school and having to be, not returning to school, returning home. And how do they navigate? I thought I was going to be able to learn how to be an adult or be on my own without mom and dad. They're in mom and dad's house, kind of adults, but not really adults, and having to follow those rules, and parents being upset and putting those restrictions of you have to be safe for COVID, and not having those normal interactions that students have when they go away to college. And then you have your high school students where, proms were affected, graduations were affected, homecomings, and those things just didn't happen. Turning Sweet 16, those big things that happen at those adolescent years, which caused an increase in anxiety because of the social factors that were stifled and stopped during COVID. We have a lot of students and patients that their anxiety and depression now returning to school as a result of COVID, thinking about OCD, which we didn't really see. We saw it before, but now we have it at tremendous rates after COVID. We have a sort of a joke around the office of, see, that people with OCD are like, see, we were right. We were supposed to be washing our hands at astronomical rates, because now look at all the people that are sick. And so seeing that the anxiety, the depression, and also some behavioral outbursts that have happened with the younger kids, they may not have the ability to express themselves and say, you know what, I'm feeling anxious. They may see it more in a somatization format, where it's more stomach aches, headaches, physical symptoms when it's manifested really as anxiety. And then also, as they're returning back to school and they've been in school, some kids have the opposite effect, whereas they became comfortable being home with COVID because that's what they knew, because they started school, kindergarten, and first grade at home. So now that they're being forced to go back to school, now you're seeing those kids develop school anxiety and not wanting to be separated from their parents and having trouble going into the school setting. And so we now need resources to help those kids in the classroom setting acclimate to being back in the classroom and learning how to have normal development, because there are very definite markers of what these kids need for emotional health and mental health on a day-to-day basis. Being mentally healthy and emotionally healthy involves not just preventing anxiety and depression, but having happy moments and being able to say, you know what, correctly identifying my feelings. You know, if I'm upset, being able to say that what they're upset about, if they're angry, if they're sad, if they're mad, and processing those feelings and being able to do so in an appropriate manner and having that expressed in school as well as at home. And I think that diversity of acclimating between home and school is very important when you're looking at returning back to school after COVID. Kids didn't have that during COVID. Everything was done at home. Home should be your safe place. That should be where your family, your comfort. School is a different place. It's a place of learning. It's a place where you grow. It's a place where you experiment and do different things. And so when you don't have that interaction, it creates the sort of the natural environment for there to be an increase in anxiety when you don't have that differentiation between home and school. So now we as mental health professionals, the psychologists and psychiatrists, we are in this gambit of looking at how does anxiety look differently now versus prior to COVID. And that's one of the things that we have new measures that are coming out. We have a post-pandemic anxiety measure that we use in testing, and it's still in its verification form in terms of making it valid across all ages. So those are some of the things that we're looking at and working with children after the pandemic.
Were homeschool kids equally affected by the lockdown during COVID?
So for me, I do forensic evaluations and also psychoeducational evaluations here in the DC, Bethesda area. And one of the things that we've noticed, which I also had a concern prior to the pandemic, is homeschooling. When you have a child that's at home, they don't have that social development, those social interactions that take place on a normal developmental basis. And what happens is you see they're not able to develop those skill sets. So for example, I'm going to give you a few examples. When we look at children in elementary school, one of the things when I was younger, we were forced to learn how to interact with your teachers, learn how to interact with the person in the cafeteria. You understand how to interact with your friends. How do we know to line up? Yes, the teacher may say line up, but if you don't hear the teacher, how do you know to do that? Because you see your friends lining up. So then we go and line up, or we follow directions. We're pulling out our reading book. Those are nuances in social interaction that prepares you for life. And when you stifle that, it's a building block for other hierarchy things. So in elementary school, you learn how to line up. When you go to middle school, you start learning how to share a locker. There's a locker, maybe have a person in a locker above you, below you. There's social graces that are taught with that. There's also the social graces of now when you go to middle school, it's a building stone for learning how to talk to a teacher, learning how to do that without the support of your parents. But if you need your parents, they're still there. And that builds into when you go into high school. So when you look at COVID, kids that at a kindergarten level, they're learning to read. Very difficult for them to start to learn how to read when they're sitting in front of a computer. How do you learn your ABCs in kindergarten? You sit in circle time on the floor and we all learn it together. You look at your friend Bobby, you look at friend whoever over here to see what are they doing, and you learn from your peers. When you're sitting in front of a computer, all of those social interactions are stifled. They don't happen because it doesn't happen in front of a computer the same way it does in person. The other piece that we're seeing is a teacher can see if a child is struggling. So if as a teacher you see, it doesn't seem to be that child A is understanding what I just taught, You might be able to go over to them and pull them to the side and maybe help them with that, or pull them aside at recess, or maybe do a little something extra with the entire class, because maybe you notice this student isn't learning it, but maybe there's 3 or 4 other students that didn't catch it as well. So you reteach it in a different mode with a song or some type of kinesthetic interaction. When you have computer online interaction, which happened during COVID, that was impossible for teachers to do that. So you had pivotal points of instruction that were lost. What we saw was a high increase of kids with quote unquote diagnosis of ADHD, but you had adults couldn't sit in front of a computer for 8 hours. So why do you expect a child to do it for 6 to 8 hours and expect them to learn what they should have learned in a classroom setting? It just did not happen. And now what we're seeing is kids that should have had those stepping stones and those building blocks, they're now struggling at older ages. So if they were kindergarten in COVID, they're struggling with reading in 3rd through 4th and 5th grade. Kids that were in middle school are now struggling in high school because now they have to make those markers of ACT and SAT prep. They didn't have some of those stepping stones in the academic realm that were missed during COVID.
Do you think that there is indeed an increased rate in boys being raised in single mother households? If so, how does this affect the emotional regulation of these boys?
Do I think that there's an increase in more young Black men being brought up in single homes? Yes. Do I think that this is causing more emotional dysregulation or an increase in emotionality of young Black men? I do. I do think we're seeing more young men that they have these increased of emotions and they don't quite know what to do with them or quite how to handle them, because historically men are strong ones. They're not supposed to be, have emotions. But if you're in a female dominated household, meaning raised with single mother, you're seeing how women interact. And so we see young men interacting more with a feminine side of emotionality and emotional regulation. And what is that doing to them? Is this necessarily a bad thing? I'm not saying that it's a bad thing. It could be a good thing. However, how does that impact their ability to interact with society? I think that's where we are struggling. So what does society say about these young men that are, now we have single mothers with young men, they have more emotions, and their emotions, they're interacting in more of a way that is consistent with how females will typically interact with each other. And how is that perceived in society? How are they taken? And how do they navigate that, knowing that this is perceived as more of a feminine way of acting? I think we have to take a close look at that. And I think we have to see that being raised in a single mother household, the dynamic is absolutely different. It absolutely changes the emotional regulation of our young men.
Is there any evidence to support opinions that boys who grow up in single family households have a tendency to be more violent?
Now, I would not say that more violence. I would think more, could be. Actually, let me not say that. It could be more violence. But when I think of like the emotional regulation, I'm thinking more of emotional outbursts. So they may cry or they may stomp or do whatever in that moment of emotional outburst, however we want to, more tantrum-like behavior is what I'm thinking like. So tantrum-like behavior, which could lead to, as they get older, tantrums could look like or could actually interact with physical altercation or more violent behavior because they have not learned to emotionally regulate themselves. Emotional regulation starts from the time when you're in a crib. This is why babies, sometimes we tell parents, you can't pick the baby up for every single thing. If a baby is crying, they have to learn how to self-soothe. They have to learn how to regulate themselves. Let them be able, whether it's a pacifier, whether it's they're in their bed playing by themselves, let them learn how to regulate themselves as an infant. Because when you get older, you may not always be able to have things your way. So if you're in an environment where you are constantly given your way all the time, or you're constantly made to feel like you're supposed to have your way. And this is not all the time, but often this does happen in households where if a mother feels, okay, he doesn't have his father or he's missing out on things, so they tend to give in more. And so the child feels like, I need to have my way all the time. And then when they don't get their way, when they actually go out into the world and they're interacting with other people and other people don't give them their way, it leads to these behavioral outbursts. How do these behavioral outbursts look as, 16, 17, 18, 19-year-old? It's not going to look the same as a 2-year-old throwing a tantrum on the floor. It's going to look as, if you hit me, I'm going to hit back. That becomes that physical altercation that you mentioned. And so I think it doesn't happen in a silo, like in a single silo. I think it have to look at all of the factors that impact that. And how does that emotional regulation build as they become an adult? When you have the balance of mom and dad, you need both. Yes, mom can baby the son and say, okay, this is my baby, blah, blah. But then you have the dad that says, hey, this is not acceptable behavior, son. You can't do this. You have to do, and however he finishes that. You need the balance of both. If you only have that one side, then it causes this emotional dysregulation where you only have that side where they're given that constant nurturing piece without having that piece of, you have to not, show these strong emotions without being able to regulate it yourself. That father figure, that male role model is going to say, at some point you have to learn how to regulate yourself. You can't depend on someone else outside of you to regulate you, to tell you to stop that. You have to learn how to do that internally yourself. When that is mismatched, that's when you have these behavioral outbursts. And then yes, as you become an adult, when you hit someone, they hit back. Causes that physical altercation that you were speaking about. But it can also not just be physical altercation. It could be, verbal altercations as well that leads to this dysregulation. If we go back and look at Sigmund Freud, we're going to go back to old Freud. And Freud says when children are learning to be potty trained, this is where you learn that emotional regulation. So what happens when a child has an accident? If the parent says, nope, you're supposed to go to the bathroom. The child says, well, you know what? This is my body. I don't want to go to the bathroom. I want to use the bathroom right here. That is a crucial moment in how the parents respond. Because what the child is doing is the child is learning how to regulate themselves. They learn, I have control over my bodily function. The parent's job is to teach them, yes, it is your body and you have control, but this is not acceptable. That is very crucial in how you teach those children. Because as we've heard a lot of times, oh, he's acting anal. They're stuck in their anal phase, or they're stuck in their phallic phase. What that's referencing is they never were able to outgrow, I can do whatever I want. Yes, it's your body and you can do whatever you want, but you also have to take in consideration other people around you. And that's why emotional regulation is so important. Because yes, you can feel how you want to feel, not saying that your feelings are wrong, but you have to understand that there's other people around you, and how you react does have an impact on other people. And so you have to learn when to regulate yourself and not act out emotionally when it does impact other people. There's a healthy way to do that. And that's what the piece that I think is sometimes missing when you don't have that balance of that dual household of the male and female role in the household.
How does the inconsistency within the relationship of the mother and father of the child affect that child?
This is a really hard question, and it's very debatable, and there's lots of research that's been done on this. And so I'm going to offer my personal opinion about this, which sometimes differs from my professional opinion of what I may say in a session with a family. But my personal opinion, based on over 20 years of working with kids and working with families, is that inconsistency is detrimental to the child. A child is not a pair of shoes that you put on and take off, put on and take off. A child is a growing, developing being. And if the consistency is not there and the parent father cannot be there for that child consistently, it is more detrimental to be inconsistent and be in and out than to just have a clean break and not be there. Allow that mother, that single mother that we just talked about, allow her to provide some type of stability for this child. If you're constantly coming in and out, how can the child learn to regulate themselves if they don't even see the regulation in that father figure, in that role model that should be there? That inconsistency actually causes more detrimental harm than if clean break, have to deal with that trauma, work through it, support that mother to maybe find other resources and other support services for that child and other people in the life that can provide that male balance that the child may need. That is definitely better than having that inconsistency in and out. Because what it teaches the child, that inconsistency in and out, is like, okay, you're important now. No, you're not important. You're important. No, you're not really important. And then what happens is increased anxiety, increased aggression, increased depression. And what we also see is then that self-esteem suffers, and the child is constantly seeking that worthy. Well, if I just do this, then I can be good enough. And they actually never fully develop that sense of self-efficacy, that sense of I am valuable, I am worthy, and I am meant to have a purpose in this life. It's all of those things are impacted or could be impacted by that inconsistency of being in and out. So it is, to me, in my opinion, it is more trauma to come in and out than if you have that consistent parent that's there, or that consistent parent that's there and just have a clean break from the parent that can't be there.